I am Dr. Santosh Prabhu, Professor of Neurosurgery at the Western India Institute of Neurosciences, which is a postgraduate teaching institute in India. I have been working with Parkinson's disease and patients affected with Parkinson's for the last 40 odd years. Whereas there is definitely a place for surgical therapies like DBS, like Wim thalamotomy for treating Parkinson's disease. These are treatments which are undertaken when the patient reaches the end of the medical road and all other options are exhausted. Only then these surgical options come into play. There are excellent medical therapies which are available for Parkinson's disease, and most of them are targeting replacement of the depleted dopamine levels in the brain in order to relieve the three principal symptoms of Parkinson's disease, which are tremors, rigidity, and bradykinesia, which is reduction in the movements of the patient. So actually what happens in a Parkinson's patient is there's a kind of internal brake. It's like your car whose brake is engaged. So the engine has to use greater power to overcome these brakes and get moving. Similarly, patients with Parkinson's disease, their muscles have an internal rigidity and the body has to overcome this in order to get the desired movement out of it. Similarly, the associated movements are also reduced in Parkinson's disease. So there'll be infrequent blinking, there'll be a mask-like faces, there'll be a robot-like walk, and so on. But overall, a holistic approach is necessary to get the desired outcomes in these patients, where the power of therapies like using table tennis shines through. In my professional opinion, the structured physical activity provided by table tennis plays a very important and critical role in managing Parkinson's symptoms. This particular sport, being a racket sport, demands high hand-eye coordination, quick reflexes, and strategic thinking to align perfectly with the therapeutic needs of Parkinson's patients. Hence, regular table tennis sessions will help Parkinson's patients to improve their motor skills, enhance their cognitive function, and of course, in addition to all this, provide the necessary social interaction. And all these benefits collectively will improve the overall quality of life for those affected with Parkinson's disease. Beyond the physical benefits, table tennis, because the reflexes, it's a fast game, it's even faster than tennis, so it's a kind of a mental workout for the patients. It demands excellent focus, full concentration, and quick decision making, which are faculties which are challenged in Parkinson's patients. Regularly playing table tennis on a day-to-day basis can sharpen the cognitive abilities of these patients and enhance their overall brain function. Moreover, as I've already said, you are having a partner with whom you are playing, there are people around you. So it's an excellent social activity for Parkinson's patients, as because of their physical limitations, the Parkinson's patients tend to refrain from day-to-day social activity. and the company and support found on the table tennis courts can be invaluable for patients who feel isolated. It provides a sense of belonging and purpose and can significantly lead to an improvement and boost in their mood and overall well being. I have come across the laudable work being done by two teenagers, Arav Desai and Tanvi Desai, who are running a not for profit organization which is launching the Table Tennis for Life initiative. Their commitment to improving the lives of the Parkinson's patients is very commendable and serves as an inspiration even for doctors and neurosurgeons and neurologists like us. By making table tennis accessible to the entire community, they offer all these patients who are affected with Parkinson's disease I would say, a kind of lifeline. I hereby encourage all patients and even otherwise to embrace the power of table tennis. Whether you are a patient of Parkinson's disease, whether you are a person who is giving care to the patient, or you are somebody who is empathetic and looking to improve their health condition and assist them in improvement in their overall quality of life.